Greetings. I am Norman Sam, the board chair of the Green Technology Education Center. It is my great pleasure to welcome you to GTEC's webinar, Preparing Your Organization for the 2024 Fire Season. In this webinar, you will meet fire ecologist Robert Gray, who will fill you in about what to expect from the 2024 and future fire seasons, and what steps you can take to prepare your organization and community. The executive director of the Mental Health Climate Change Alliance, Alexis Paler-Fluevog, follows with a personal story introducing the emotional and mental health impacts of fire and smoke, as well as steps to take to assist organizations and communities. Physician Linda Thayer addresses the medical impacts of toxic smoke and the preventative measures available. Linda is a GTEC board member and co-founder of Doctors for Planetary Health. The webinar concludes with a section by SFU Associate Professor, Faculty of Health Sciences, Anne-Marie Nicol, that describes an affordable, do-it-yourself air filtration system that she and her colleagues have developed, tested, and shared in workshops with a number of communities. The webinar is moderated by GTEC Executive Director, Arden Henley.
Well, thanks again for doing this, Bob. And I was thinking by way of introduction that with all the rain we're having, I'll bet that many people are thinking, fire season? What? Maybe there's not even going to be one because we've had lots of rain, but I know that's not the case. And so what do you think we'll be facing this summer?
The long range forecasts are for above normal temperature and below normal precip. Alberta has already declared an early fire season in February, so that happened yesterday. We still have about 96 fires wintering. They're referred to as zombie fires, but they're basically overwintering fires. So, and if they're in a vulnerable place, then they can certainly kick up because the north does dry out, early in the spring. So kind of March, April, May. It all comes down to the precipitation, how much precip we get. We don't have much of a snowpack, which is more of a drought issue than a fire issue. There's used to be that if we had this heavy snowpack, then the thinking was that we wouldn't get much of a fire season. But that correlation doesn't stand up because the snowpacks are coming off very quickly in the springtime. So that winter snowpack isn't really a gauge of what the summer is going to be like. So an indicator that it might be a bad fire season is just the drought. We're coming into year 2, 3 now. The ground fuels, that's the duff, the organic soil, buried roots, those sort of things, that is very, very dry. And the large fuels on the surface, logs, branches, things like that, they are also very, very dry. So if we start to get fires in the spring and it gets into those ground and heavy surface fuels, then they release a lot of energy. They dry out fuels, adjacent fuels in the process, and they're also very hard to extinguish. So they tend to suck resources. So if you have even a medium scale fire in large fuels, it takes a lot to extinguish it. So they tend to pull a lot of resources in. If that pattern persists, then midsummer later on, you just run out of resources. So every subsequent fire gets bigger because you don't have enough people to put on it. So that early draw of resources can have a long-term effect down the road in the fire season. So with the drought, fuels drying, we could be in for another significant fire season. It just comes down to the precip.
Bob, are there areas of the province that are particularly susceptible in your view?
The north, I saw a drought map the other day, and it's extreme drought. Central Caribou-Chilcotin, which had another bad fire season last year, is very, very dry. The southeast, so those areas are kind of set up to see, and they also don't have much of a snowpack right now either. So we'll see what happens in those areas.
Bob, what have we learned so far about the degree to which communities are prepared to face the kind of fire seasons that we're having now with climate change?
Yeah, that's a good question. It's really kind of an uneven approach that we're taking. Some communities are investing heavily in fuels work, mitigation of fuels around communities. Others are working on bylaw changes, educating the public. The funding right now that we have through the province is kind of sort of heavily focused on this idea of changing human behavior, which is a difficult thing to do. If you're basing your entire community protection from wildfire on changing human behavior and that sort of thing, you're not going to be very successful. Safeguarding a community from fire means dealing with what generates the fire, which is fuels. So when we're not doing that at a large enough scale, it's also difficult to do adjacent to communities because of private land. So if you're working on Crown land or adjacent, city-owned land, you can do that. You end up with this Swiss cheese approach where you've got some areas treated, they tend to be postage stamp size, and there's lots of holes between that, and there's lots of gaps. And one of the things that we look at with fire is this idea of percolation theory. So it's the idea that fire can sort of move through these gaps quite easily. The more sort of speed bumps there are in the way, the harder it is for fire to move through. So having more contiguous areas treated is the key. We don't have any program in the province right now to deal with private land. You're on your own when it comes to dealing with private land. Other jurisdictions, especially in the Western US, every state has some type of an in-kind funding system. They'll do means testing to see if you've got the income to do it, resources, and they'll pay 100%, the feds will. So they take that quite seriously. It's an all lands, all hands approach. We take a different approach here in BC where there's programs for Crown land, there's some programs for city land, municipal land, Indigenous land, and there's nothing for private land. And even the municipal lands, like I said, it's this sort of, we're going to put a little bit of money into fuels, we're going to put a bunch of money into changing human behavior, and it's not a successful approach.
Bob, bearing in mind that our audience today is community social service organizations, what steps can they take to prepare for the upcoming fire season?
That's a critical one. Social justice is a big part of this. The at-risk communities are suffering the most. Identifying who your most at-risk members of your community are, evacuation is first and foremost when it comes to preparing for wildfire at this stage. We're not going to get a whole bunch of fuels done in between now and fire season. So basically right now it's just sort of hold on tight, see what happens, and be prepared for the response, which would be evacuation. So identify that group, have them prepared. You can go on the Fire Smart website or their websites, and you can basically get an idea of the checklist. What do you need to have ready to go? So medicine, identification, dog food, dog medicine, all those critical things you need to have ready. Getting people ready to evacuate is the best thing they can do right now. We don't want to have to evacuate, but in the event that we do, we need to be prepared for that. So all those valuable belongings that we need, have them up and ready. Identifying ahead of time where you can go. So those who have means, they can get out and go to a hotel, they can go with friends. People who don't have means, they'll be, basically sent to shelters, community shelters that are set up. Red Cross will do other things as well. So identifying where you can end up going ahead of time is really key. Where is it likely, if you did have to evacuate, where would you go, and identifying that ahead of time, well ahead of time. So the particulars you need to evacuate, some money, some resources, and then where you can possibly go. If you have pets, that becomes one more sort of difficult logistical thing. If you've got livestock, that's an even bigger thing. If you've got horses or other pets, then, identifying ahead of time how you can transport them as well as where you can transport them becomes really critical. So I think from a sort of a social services perspective, I think those are the keys is, what's your most vulnerable population, getting them prepared, and identify where they can end up going ahead of time. Those are all really, really key. You don't want to be doing this at the last minute. Typically, the pattern we see for evacuation orders is midnight or sometime early in the morning, and you don't want to be scrambling at that during an evacuation order. The other thing is if you get an evacuation alert, that usually means get ready to go. And it doesn't mean, we're going to sort of laissez-faire approach to it. Evacuation alert means get ready.
Bob, I'm thinking also of this issue that comes with wildfires that may not necessitate evacuation, but hits people hard, and that's the whole toxic smoke, particulate matter phenomena. Do you have any thoughts about how organizations can help with that?
Yeah, identifying, we're not, we haven't developed clean air stations here yet in BC. I know there's been discussion about it. Other jurisdictions have done that. They've actually set up places where people, at risk members of the population, can go indoors where there's, basically plenty of air filters and other apparatus to help with clean air. Stay indoors. If you can afford to go and get a standalone air purifier with the right kind of filters, extra filters to have on hand. But once we start to see that air quality degrade, then it's so important to stay indoors. And it's important to identify that at-risk population, who is most at risk from a cardiopulmonary perspective. When we look at the statistics for those most at risk, it's the young and the old. But then there's other people who have pre-existing conditions. So certainly that's key. It's also important to know that, if it's wildfire smoke, then we know a lot of the constituents, and particulate matters is the big problem. It clogs the lungs and it impedes air passage. If it becomes a interface fire where it's not just wildland fuels burning, but it's also houses and cars and boats and the whole bit, that's especially toxic. That contains carcinogens. So that if that's the case, like it was last year with people who lived in Kelowna or Lake Country or Vernon or Shuswap, when the fire went through Shuswap and West Kelowna, that smoke column was full of toxic material. That's especially important to stay indoors. If you do have to go outside, an N95 mask at the minimum, or basically a breathing apparatus. So stay indoors, clean air. If you're rough sleeping, if you don't have a home, find out where there might be some clean air stations. That's critical. If you do have to go out, N95 masks. If we have people who are living on the street or don't have homes, is if we can somehow distribute N95 masks to them, that's really, really critical.
Bob, and finally, I know my colleagues, when they listen to you, will be thinking, well, what, if any, resources can we as organizations access to help us do the planning and take the steps that flow from this?
Yeah, that's a good question. Right now, a lot of the emergency management is done through OCDs, so Operation Centers, and Emergency Management BC. And the few NGOs that they do use tend to be Red Cross or others. So it wouldn't hurt to, with your organizations, to reach out to Emergency Management BC and see if there's a role that you can play, either some preparation work or some mitigation work, or if you can help with the social justice side of things. That would be the institution to contact. It wouldn't be BC Wildfire Service; they're operational, but the Emergency Management BC, they, all this other stuff sort of falls under their umbrella. So definitely reach out and see what role you can play as volunteers, and see what they say. It'd be very interesting to see if they can carve out a role for you.
Bob, finally, is there any question I didn't ask that you feel I should have asked and you want to speak to?
Just that what happened in 2023 and 2021 and 2018, they weren't anomalies. There's still some hesitation on the part of our government, both provincial and federal, that somehow we're going to lapse into some pre-disaster normalcy, and that's not going to happen. We need transformational change in how we deal with these crises, and we're still bumbling along in the dark in a lot of cases. We've got some great people doing great work, and BC Wildfire Service, they're doing the best they can with the resources that they've got, but they've been dealt a very, very difficult hand. The condition is only going to get worse. Studying climate science, the anomalous sort of temperature curve that we're on it's increasing at an alarming rate. So fire seasons like 2023 and worse will happen more frequently. It may not happen this year. We may get a down year, may get another down year after that, but once, we're going to get another 2023 and worse. So if we're going to reduce the impact on society and the environment and the economy, then we need to do things drastically different. It's going to require significant investments in money. And so far, I'm not seeing it. We have not seen any infusion of additional resources to tackle this problem at scale. And the pace has to pick up. We have about a 10-year window to get out ahead of this thing. And after that, we're not going to have any ability to do anything positive, very little things positive. So we've got a narrow window here. If we want some type of a semi-healthy environment for our children and grandchildren, then we have to do things differently, and we have to do things quickly.
Bob, thanks so much. You're very clear and articulate, and I really appreciate it.
I come to this with a personal story. So my brother and his family have lived in Yellowknife for the past 20 years. And as many people will remember, last year was a remarkably difficult year for Yellowknifers. There was a huge fire, actually a number of fires surrounding the city of Yellowknife. And after weeks of really dense smoke, it was decided by the government that an evacuation needs to occur. So my sister-in-law and the kids got on a flight, flew to my parents in Ottawa. So first of all, they had means, they had a place to go. They got out. My brother stayed behind out of concern for elderly neighbors, neighbors without a car, also their dog, small things like they didn't have a carrier for their dog, and so the dog couldn't get on the flight. And I mean, you try telling a 10 and a 12-year-old that they can't bring their dog with them and there's a fear of fire. That just did not fly. It was a non-starter. So my brother stayed behind, which was very difficult. It was a difficult decision to make. It was probably the right decision at the time. He was able to get out his neighbors. They got into his truck, and he brought his two neighbors, the dog, and some other items from friends' houses that they left in such a hurry they forgot. So he was able to get out. He had thought about this beforehand and had prepared by having enough jerry cans full of gas in his truck. And he was able to drive out, get to Alberta, and stay with family friends. So again, had a place to go. He then dropped off the various people where they were going, and then he left his car in Calgary, flew to Ottawa. So again, had the means, had a place to go. The family was very shaken up. The whole thing was very difficult, as well as the thought of being torn apart was very difficult. Northerners are a very tight community, so they really took care of each other, but it was a really scary time. And they ended up being away from their community for almost a month, filled with uncertainty, not knowing if their community that they loved so much would be there. And then my niece and nephew worried about their friends. Some people refused to leave, so they were very worried for their friends. And they were also worried, interestingly, that people wouldn't return. They were really worried that life would be different once they returned. So once they did return, they went back to school, but there was very little follow-up in terms of mental health support for people. And it was more difficult than people thought. They sort of had this idea like, we'll get through it, we'll bond together, everything will be fine. But now, and just speaking with my brother a few days ago, now it's February, there's already a fear about what's happening in the summer. Where summer used to be something exciting to look forward to, now it's fear. And so that leads directly into these psychological effects of the impacts of fire and smoke events. We know that the psychological effects can be long-term, and we know that they can pop up when you kind of least expect them. So you're expecting the stress reactions and the trauma of losing the material things, the buildings, some of the infrastructure. But what I think causes a lot of discomfort for people is the grief and the loss of the natural world and what they're seeing around them. So they return to a place and it's home, but it's no longer really home. This fear of future events. So people already preparing for a summer. So looking at just this crazy weather season we've had in BC, and then people in Kelowna understanding it's going to be a tough weather season. So this fear of this happening again, that can be really heavy on people, as well as maybe people in Vancouver or other areas may choose not to go to these areas because they know there'll be fires. So then there's a financial stress as well. What we see from so many other extreme weather events and also from the COVID-19 pandemic is that communities that were in partnership with other cohesive and strong communities before an event are more likely to be resilient after an event. So establishing partnerships with other organizations can be a really helpful way to figure out what they can offer, what you can offer, how you can go through these things together, even just going out for a coffee with somebody just to learn what they're doing and who they serve, so that if that comes up in your own work, you have a face, you have a name, you know who to talk to. So that's really important. Training and support is really important as well. So training people to look for these signs of psychological distress is really important as well. So understanding that everybody has unique mental health needs, but learning language about how to talk to people about these climate related events can be really powerful. Also, having support groups is really important. Understanding different ways to coordinate resources can be very important as well. Setting up crisis counseling services, that can be exceptionally important, especially for first responders, because we know that first responders see things and experience things that we can't even imagine. So ensuring that they get what they need beforehand, that there are systems set up to help them if they need a place to stay, or they need childcare, or they need someone to talk to. Just sort of thinking through what's going to happen, worst case scenario, and building these bonds beforehand will really serve people during and after an extreme event. And then also the development of informational materials. So never underestimate the importance of a pamphlet or a digital media.
At this point, I'm happy to introduce Dr. Linda Thayer, a member of the GTEC board and the co-founder of Doctors for Planetary Health. Given that it's likely that we will experience further wildfire and toxic smoke phenomena, what can community organizations do to help out with this particular challenge?
So I think one of the first steps is to be aware of what the air quality is in your community. There are air quality monitors that the government has put out in certain areas, but there are many areas of the populated areas of the province that do not have monitors. If there's a way for organizations to get their hands on a monitor that can actually provide some of the data, and right now there are national bodies working to provide some standardization of what are the things that should be measured, because different monitors may be measuring different particles or different types of materials, and what the standards should be, because it can be a little bit different across the current apps that are available. Trying to provide monitors in the community can be one important first step, because as I said, that these are not necessarily available, so people may not be aware of the air quality in their community. So that's an important first step. After that, trying to find spaces where people who do not necessarily have the means or the capacity to have an air filter in their home. Air filters can be hugely important in terms of reducing that particulate load, these particles that can be harmful to the health. Some people may not have that available. Unhoused people are particularly at risk for that. And if there are spaces that organizations can help to organize where people can go, if those are not available, then providing masks. N95 masks can be very helpful in filtering out some of this particulate matter anyways, not necessarily the gases, but the particulate matter. So making those available to people, especially unhoused people, those who need to work outside can also be particularly affected as well. And then some other things is just to being aware of those vulnerable populations, the people who, pregnant women, young children, the elderly, those who have chronic diseases that may be worsened by the particulate matter, finding out who those people are within the community and setting up the systems to be able to check in. So we all need to check in on our neighbors when these events happen to make sure that they have access to the resources that they need, or helping them to find those resources. One of the issues too is that when these events happen, the poor air quality events happen, we do see a greater load on the medical system. So even the people who have other issues, medical issues that are coming up, when the health system is being overloaded by these increase in respiratory illnesses and that kind of thing, then we see an overload on the healthcare system too. So there's a lot that can be done in a preventive way, just to help reduce that load so that the people who need healthcare for other reasons are able to access that as well.
This has been so helpful. And as I listened to you talk about these steps that organizations can take, I was also thinking that information is probably important.
Absolutely. More information that we can have out. And there are national and more local organizations. The BC Centre for Disease Control, for instance, has information on wildfire smoke and steps that people can take as individuals to help to protect their own health. Health Canada also has information.
I was listening to you talking about the air quality monitoring, which I've really only learned to look at over the last couple of years. And I thought, I'll bet a whole lot of people don't even know there's such a thing.
You're absolutely right. I think a lot of people don't know about that and don't know what to do. There are recommendations that go along with the various levels of air quality. As the air quality becomes poorer, there are recommendations in terms of the activities that can be, or even just going outside. As I said, again, there are an increasing number of apps that may display a variety of different information. So we're still waiting for that standardization.
Yeah, and communities need to be informed about where to find those and
Yes.
what they mean. It needs to be all translated into language that the ordinary person can understand so that they can begin to make use of this.
And on that note, even the languages of specific communities who may need to have translated literally into the language of the population. So organizations may be able to help with that, identifying the populations and their needs in terms of that education specifically in their language.
At this point, I'm delighted to introduce you to Dr. Anne-Marie Nicol, a professor in the Health Sciences faculty at Simon Fraser University.
Hello, Arden. Thank you for having me on today.
Anne-Marie, I'm curious how you got from your background in infectious diseases to wildfire, toxic smoke, and air filtration.
I spent a lot of time during the COVID-19 pandemic working for government. And in that process, I learned about air cleaning and the importance of air cleaners in reducing exposure to pathogens. And those same devices, which were developed in the United States, also were effective at removing particulates. And I had been running them in my house myself, and it occurred to me that these were also going to be useful for smoke and other particulates. And sure enough, a colleague of mine was doing some research looking at their overall effectiveness as an air cleaner for different substances. And sure enough, they work as well for fire smoke particulates as they do for things like COVID-19.
Wow. And the device in question is something that people can make themselves, I understand, using pretty readily available components and much less expensive than your standard HEPA filter air filtration system that you can buy commercially.
That's right. In fact, the technology was designed in part to be do-it-yourself, and they're simple units that people can use and make. The products that you need to make them, you can buy at a local hardware store. That's part of the deal, and they're easily made by people anywhere from young people all the way up to seniors with arthritis. And I know this because we spent last summer teaching all sorts of different people how to make them, and we were quite successful.
And tell me, what do these air filtration devices that you've developed look like?
I'm going to show you a slide here. There's all sorts of different kinds that can be made. And my colleague at the National Collaborating Center, she did a robust analysis of what they could look like. But what we found, and we built this 1A in the corner, this is the simplest one. These are what's known as a Corsi-Rosenthal box, the bigger ones. But they all are very effective at reducing particulates. These are simply the easiest ones to make and the lightest ones to carry.
And how do they work?
They work incredibly well. That's the other, piece of the puzzle. So I'll share this as well. We did a roundup. This was my colleague, Dr. Eichelbosch. These are all publicly accessible documents, but she did an analysis of all the research that's looked at these units. Lots of people had questions. How is it that stuff that you can buy at a hardware store can be as effective as a $300 Honeywell air cleaner? And if you use the right specifications, a MERV 13 or better filter with a powerful enough fan, and you use the appropriate room space, you can actually have an incredibly effective device. So the results of the research were that these are effective, affordable, and accessible technologies and tools that people can use. The review includes a robust synthesis of all the research that's been done to date, comparing these units to commercial units. And what we find consistently is that they cost between 14 to about 30 cents per clean air delivery rate. That's what you use to analyze whether or not your air cleaner is working. And you can see for this study, a 1x1, that's the simple one, compared to a commercial one, is about a quarter of the cost. So they are fantastically more accessible for most people, the way to go about cleaning an indoor airspace, mostly a bedroom. They're not designed for huge rooms, but they're useful for bedrooms and small rooms.
And Anne-Marie, oh, here you go. Yeah, I love
I can see a picture. Okay.
Yeah.
So again, we call these the 1x1, and you can make a bigger one. But this is basically what they look like when they're done. And as part of our project, we gave people the opportunity to decorate them. And that was actually a really important part of this project because people really wanted to get making them right away. We had many people show up at workshops because they're concerned about smoke and they're concerned about the future. And it gave them an opportunity to come and talk about fire smoke with students from SFU and myself and other experts. We had medical residents come and a bunch of different people, and people could decorate them afterwards. We had a myriad of stickers, and we also just gave people a chance to chat with each other and us about pressing topics. And not only did people want to know about fire smoke, but they also wanted to know about extreme heat. So we broadened the project a bit to include handouts and some information locally about both clean air spaces and cooling centers for populations over the summer of 2023. And so we were very fortunate to get funding from Van City, the City of Vancouver, and the BC Lung Foundation. And I work for the Pacific Institute for Pathogens, Pandemics, and Society at SFU. My original interest, again, was in pathogens, but it evolved into this: how do we help people help themselves during emergent health threats? And fire, smoke, and heat are the two things that most people are grappling with now. So we developed these instructions with the idea as people would come to our sessions, they would get the materials to make one themselves, and then they could hopefully go home and tell two people, and it would sort of go viral in the sort of old-fashioned way we understand things going viral. So it is quite a simple recipe. You need a box fan, a MERV 13 filter, some duct tape, and something sharp to cut things with. And it goes together quite simply. The filter goes on the back of the fan. And then there's a bit of a science here, ventilation science. It's not rocket science, but it's ventilation science. You tape off the corners to prevent the air from being sucked back in. It forces more air to go back through the filter. It's called a shroud. We get lots of people ask us, why do we have to do this? But there's some science here that makes them more effective. And then you can personalize it. And people made incredible versions of the air filters. Some were rainbows and some were very black and some were just all white and pristine. We had lots of different kinds of stickers. So again, I think that personalizing it is an important part of the process. We also made a simple version to hand out with kind of a shopping list and a guide for how to people just if they wanted just something that was simple and how to run them, because it's important not to put them in windows. You can't get the filter wet or it doesn't work that well. And you shouldn't push it up against a wall because it won't have enough opportunity to clean the air. Just a bit of extra information. People want to know, well, how much does that cost per unit? So if you're someone who can buy in bulk, you can get the per unit materials costs down to about $70 to $75 per unit. And again, that operates at a between $200 to $300 rate for a commercial unit. So this is cost effective if you can buy in bulk. We also found that, there's a rate limiting factor. So it works well if in a space that's indoors. Outdoors is a bit harder. There's some machinations to it. And just to be clear that I didn't invent the science for the air cleaner. It was invented in the United States by other researchers and engineers. We're just taking that knowledge and moving it into practice in community. So that's my contribution.
Thank you so much for this informative and very helpful conversation today.
Thank you.